The Centers for Disease Control and Prevention has issued new recommendations today for preventing sexual transmission of Zika virus. The agency says men who've traveled to Zika-affected areas should consider not having sex with their pregnant partner for the duration of the pregnancy, or always use protection. The new federal guidelines come after Dallas reported the first local and sexually transmitted Zika case in the United States. This week, Georgia and Washington, D.C. confirmed a total of 4 Zika cases, including 1 pregnant woman. Around 35 travel-associated Zika cases have been reported in the U.S., prompting one southern state to declare a public health emergency. RT's Marina Portnaya brings us that story.
In the Sunshine State, the threat of a Zika outbreak is being treated like a potential natural disaster.
Just like a hurricane, we have to ensure that Florida is safe. Just like in a hurricane, what we always say to ourselves is we're going to prepare for the worst and hope for the best.
With at least 12 confirmed Zika infections, Florida is the first U.S. state to declare a public health emergency over the virus. The governor's executive order applies to 5 counties where people have tested positive for Zika. Officials say all cases are travel-related and no patient is pregnant.
The mosquito that causes Zika virus is common in Florida.
The Aedes aegypti mosquito, the primary vector for Zika, can contract the virus by biting an infected person. The public health emergency allows for more mosquito spray and other measures to be used in the 5 counties with infected residents.
Inspections, elimination of mosquito breeding, ground containers, and spraying and taking all the measures that we need to control the mosquitoes. Trying to avoid this person becoming in contact with the mosquito bites and transmit the disease locally.
Some say more needs to be done to prevent the virus from accidentally being imported into the U.S. Florida is the second most visited state among foreign travelers. In 2014, 4.7 million visitors came here from South America, a region the CDC has urged pregnant women not to travel to because Zika is so widespread.
What we need to worry about now is South Florida is a huge network. Ships coming here, cruises from South America. Those things need to be monitored so that we do not expose people to the possibility of the mosquitoes already carrying the virus coming into the system. But the mosquitoes tested so far have tested negative.
Zika has ignited global concern due to its link to microcephaly, a condition causing infants to be born with partially formed brains and abnormally small heads. More than 4,000 babies have reportedly been affected in Brazil, where the outbreak began last May.
I'm urging the Center for Disease Control to conduct a conference call within the next 2 weeks with Florida hospital workers, especially for those who work with pregnant women and OBGYNs, on how Zika is spread, its symptoms, treatments, and proper precautions.
Florida is purchasing 4,000 Zika antibody test kits and requesting 1,000 more from the CDC. It can detect if someone ever had Zika. As for all the ways the virus can be spread, health officials say there's a lot still unknown. Marina Portnaya, RT, Miami.